upper limb arterial Doppler. The upper extremity arterial Doppler is very important, especially when the patient has got numbness or gangrene or any arteriosclerotic disease. Let's discuss the main things which we have to look for while having upper extremity arterial Doppler. So part of peripheral arterial Doppler, actually the peripheral arterial Doppler includes the upper limb and lower limb. In lower extremity arterial diseases, we usually find intermittent claudications, severe ischemias, and symptoms of the arterial diseases of the lower extremities are intermittent claudications, severe ischemia. We can also have this claudication in the upper limbs, and the risk factors for arterial diseases are the advancing age, sex, hyperlipidemia, hypertension, smoking, diabetes mellitus, family history, and homocystinuria. Lower extremity arterial disease, the arteriosclerosis, thickening and loss of elasticity of the arterial wall is seen. The pathophysiology is plaque is a raised focal lesion within the intima causing partial or complete occlusion, and the classification of the medial layers causes a gradual loss of elasticity. Weakness of arterial walls predisposes to aneurysm, dilatation, or thrombus formation, whereas artery is unable to transport an adequate blood volume to the tissues during exercise or rest. We are discussing the arterial diseases which are common in upper limb and lower limb. So, once we finish this, then we will come to the specific diseases which we can find in the upper limb. So, the most common sites for plaque are the large elastic arteries like aorta, carotids, iliacs, large to medium sized muscular arteries, for example, the coronaries, renal, lower limb, mesenteric, and cerebral vessels, and most prominent at branching points of vessels. The advancing plaques, they progressively enlarge, ulcerate, or rupture, undergo hemorrhage, causes pressure atrophy. This is the pathophysiology, how the plaque is formed. This is the wall thickening. So we can have stenosis, area with diameter narrowing at arterial lumen, and increasing the peak systolic velocity is seen with increasingly narrowed lumen. And occlusions, we can see areas where the lumen is completely blocked with no flow present. This is the stenosed area where you can see in the lower limb the femoral artery which is blocked. So the Doppler indications for peripheral arterial diseases, either it is lower limb or upper limb, the same indications, assessment of disease in patients with ischemic symptoms of the upper or lower limb, follow-up of procedures like bypass graft procedures, angioplasty procedures, diagnosis and follow-up of aneurysms to the peripheral arteries, diagnosis and treatment of false aneurysms, diagnosis of pulsatile lumps, and assessment of the dialysis shunt. Similarly, in AV fistula, arteriovenous fistula, the turbulence of the site of the fistula is seen, and proximal to AV fistula, low resistance arterial flow patterns are seen. Distal high resistance arterial waveforms are present, and veins proximal to